As we know, IUI is procedure that can be done to improve the chances of fertility. So this process of IUI nowadays is routinely done under ultrasound guidance. Transabdominal scan as well as transvaginal scan helps tremendously in improving the success rates in IUI as well as improves patients' satisfaction. So in IUI, we are processing the semen sample. This kind of processing will remove all the dead sperms, seminal plasma, debris, and enzymes from the semen, and the concentrated sample of processed sample will only have motile sperms in it. So now this post-wash sample, which contains motile sperms, in fact, is free from dead sperms and debris also. Because of this, it improves fertilization potential and reduces the risk of infection by eliminating bacteria and viruses which are present in the seminal plasma. The patient to fill up her urinary bladder just as the processing is going on. Doing a transabdominal scan will help in straightening the axis of the uterus and the cervical canal. This kind of straightening helps in introducing the IUI catheter into the uterine cavity easily. But certain times, the internal os is very tight, as it is seen in this case. Look at that white catheter that is twizzling at about the internal os level, but is not able to enter the cavity in spite of repeated attempts. So, in such cases, we would have to pass a sound, that is, uterine sound. While passing the sound, it will be better to straighten the axis of the cervical canal at about the internal os level by giving a pull on the cervix, holding it with the Alice forceps or a tenaculum. If this process of passing the sound is not successful, then that means the cervical canal is tortuous at about the level of internal os. So, a tortuous cervical canal can be dealt with easily by using embryo transfer catheter. We have used a Sure Pro Valus embryo transfer catheter in this case. Sure Pro Valus embryo transfer catheter is echogenic, so we can see the entire catheter very clearly in ultrasound. As and when we have to cross the internal os and the catheter tip is seen inside the uterine cavity, gently taking time, bit by bit, the semen sample, processed semen sample, is pushed into the uterine cavity. Take time to push the sample. Don't push it all at once because there would be regurgitation of the processed sample back into the cervical canal if you are in a hurry to push it all at once. Taking time, pushing little by little at a time, gives time for the sample to accommodate itself into different areas within the uterine cavity and thereby allows it to settle only and only in the uterine cavity. So, doing a transabdominal scan guided intrauterine insemination also mimics embryo transfer. This kind of patients, if they are not successful in IUI and later if they have to go for IVF, we know that we have done IUI with the embryo transfer catheter, then means we would have an easy embryo transfer during IVF as well. It acts as a trial of embryo transfer. Also, while doing a transabdominal scan guided intrauterine insemination, we can turn the ultrasound monitor towards the patient so that she can observe as to how the sample is entering into her uterine cavity. This ensures to improve the chances of pregnancy because patient's attitude towards this treatment becomes positive and chances of pregnancy in patients who have positive attitude towards the treatment is definitely more than normal. In some patients, we see that they would have wide open cervical canal, also a patulous internal os. In such patients, straightening the uterine axis by doing a transabdominal guided intrauterine insemination will further increase the chances of the processed semen sample coming back into the cervical canal and into the vagina And hence, in such patients, we would ask them to empty the bladder and do a transvaginal scan guided IUI. So, this patients, we first introduce the IUI catheter past the internal loss level into the lower uterine cavity level, and then we pass the transvaginal scan probe. This probe is pushed in such a way that the cervical canal gets occluded. Pushing the cervical canal or pushing the cervix forwards towards the pubic bone will occlude the cervical canal or also will close the internal os. After having done this, we push the process semen sample into the uterine cavity slowly and make sure that the cavity gets distended by the fluid that we are sending inside. So, this is how a transvaginal scan guided IUI helps in improving chances of pregnancy in patients who have a patulous cervical canal or wide open internal os.